Okay, so I also want to talk about the support that I have been receiving. I have 3 people who are faculty of the Gemstone Therapy Institute, and also someone who we kind of call affectionately our dean of the GTI, just because she's been with us for so long and is just an encyclopedia of all the work that I've produced over the last how many years. And so those 4 very beautiful angels have routinely give me a session every month. They take turns. Well, when I went into the hospital, or I think maybe it started before then. I'm sorry, my memory is a little fuzzy. They started giving me sessions every day. So every day I got a diamond and gemstone therapy remote session from them, which is just so wonderful. And then after, when I left the hospital, I said, okay, I think I'm ready for every other day. So I'm getting sessions every other day from them. I'll talk later about the gems I've been working with. There's just so much to cover here. So a big question was, what was impacting me? Because if they took out about 12 inches of the intestine, and there's a 3 or 4 inch margin on either side, what on earth was that 5 or 6 or 4 to 6 inch impaction in the middle? Well, they said they sent it off to pathology, so that was Sunday when I got the surgery, and I probably wouldn't get the results until Friday. Well, Friday, I'm all about to leave the hospital. I can't wait to get home. Yeah, the pain is a lot, but I'm managing it with the meds. I have meds to manage the pain, and so I'm ready to go. It's around 5 o'clock. Suddenly, transport arrives and says, oh, you have to come in for a heart echo. Okay. I knew something was up. Something was up. So I go in. I've been to heart echoes, dozens and dozens of times for my whole heart journey. And you just lay back and let them do their work. Very comfortable experience. Sometimes I fall asleep. Sometimes I watch the monitor and look at my heart from the inside, which is fun. But I knew something was up. I'm going through every system of my body, trying to figure out, okay, where's the cancer? Where's the cancer? Where's the cancer? Is it here? Is it here? Is it here? I went through all the 21 systems I've so far identified. No, none. I just got to know. No, it's not here. It's not here. Okay, so I let it go. I thought, well, maybe it's not that. Maybe my transplant team just wanted to get another look at my heart because of the surgery. I mean, who knows? Who knows? They're very protective of me. They're very, very detail-oriented. Okay, so I get back to my room, and this person walks in. To me, she's a young woman, but she's a physician's assistant, so I'm sure she's not as young as she looked. But she said, Mrs. Morton, I'm so sorry to tell you, but you have blood cancer. Okay, well, what kind? It's a non-Hodgkin's large B-cell lymphoma. Okay. And I said, well, what are the symptoms? And she goes through the symptoms. She asks me all these questions. No, I don't have this. I don't have this. I don't have this. Yes, I've had some profound fatigue. I thought it was more related to chronic fatigue since it tends to come and go. I tend to get it for 3 months and then it disappears for 6 to 9 months and then it comes back. A lot of just chronic fatigue kind of things. And so that was the only checkbox that I had, except the biopsy of the impaction was a lymphoma. It was like a mass created by this condition. Okay, so the miracle was that they caught it so early. It's like, oh my gosh. When I came back from Paris 2 years ago, I came back with, oh, it was horrible. I was in Paris for 5 days in bed with terrible respiratory illness, which I found out when I got back to the States was COVID. A few weeks later, I had terrible abdominal pain in my upper right quadrant, and they found out that I actually had two PEs, two pulmonary embolisms that had resulted from the COVID. So I felt that that was a miracle too, that without that pain, which seemed completely unassociated with pulmonary embolisms, but that's what got me to the emergency room where they were able to diagnose the pulmonary embolisms, and I got blood thinners, and all was well. I have had no issues with that since. So this, I felt, was another miracle. And I think she was a little taken aback by my attitude, because I am just seeing the grace of this and how amazing the coincidence was that this impaction occurred, local area, got me to the hospital. I've had other intestinal issues that I have no doubt are going to be cleared up by this. And here I have this diagnosis and catching it so early. Isn't that a wonderful thing? So yay! Okay, more in the next video.